All right, I have everybody's paper. Okay, I know this was a little bit awkward. Thanks for sticking around to talk about Staphylococcus. All right. Full disclosure, I had a fight with Ninhydrin today, so you saw my hands. That's why I'm all purple. Well, it looks really weird. All right. All right, and I heard the tornado warning was canceled. So good news, we should be safe. Didn't have to leave in the middle of the exam. So. Okay, so we were talking about Staphylococcus. Monday, we will definitely look forward to the final and we'll talk about what that's gonna look like. So stay tuned for that. But at the end of the semester, we get to talk about some individual pathogens, and it's kind of a nice wrap up the semester because we're kind of pulling some things that we talked about all semester. So, and hopefully it's interesting. Like, you know, those of you that are interested in going to the healthcare field, it should be interesting, or just personally interesting. We know somebody that have had some of these infections. So. We started, let's see, last time we talked a little bit about Staphylococcus, some of the kind of overall characteristics of Staphylococcus. So continuing with that, I want to talk specifically about Staph aureus. Okay, this is an organism that you've used in the lab. Some of you may have this as an unknown. So you have seen this before. Again, if you've been in lab, those gram-positive cocci. On a plate, aureus is actually Greek for gold. So oftentimes the colonies will look a little bit yellowish. The strain that we like to use up in the lab is less obviously so. We don't want it to be, you know, obvious for your unknown. Oh, it's yellow. I know what I have. Okay. Where do we find it? It's very common for it to be normal microbiota. Skin, upper respiratory tract, places like that. People argue about whether it should be considered a true pathogen or an opportunistic pathogen, because it actually, you have to be exposed to about 1 million cells at, you know, the correct portal of entry for you to get an infection. So that's pretty high. Again, it does cause, as we'll see, a lot of different kinds of infections, but again, people argue about whether it's a true pathogen or it's just considered opportunistic. Commonly transmitted in hospitals, also in the community. So we'll look at some different infections shortly. But before we look at some different infections, let's think about what has made this organism successful in causing an infection. And not every strain of Staph aureus would have every one of these virulence factors. But these are some of the common ones, okay? So common for a lot of organisms to either have a capsule or a slime layer. So remember, a slime layer is just kind of a thinner capsule, you know, to some degree, at least somewhat of a kind of protective layering around it. That helps inhibit the organism from being phagocytized by macrophages and neutrophils, and also helps it kind of stick to surfaces, like maybe some kind of artificial implant, like a artificial knee, something like that, and also helps it to kind of stick together to form biofilms. Let's see, what else? Another structural virulence factor is called protein A. Not a very original name, whoever named this. But this is a surface protein. Again, that Staph aureus have, most strains of it have. And what it does is it binds to the FC portion of an antibody. Okay, so remember the FC portion, that's the stem region. Okay, so in this picture down here, you've got this protein A all over the outside of the cell, and it's binding to the antibody at that stem. So the analogy that I like here, what's the so what? If you're trying to catch a snake how do you catch it, right? You grab it by the back of the head, right? All those normally, maybe you don't catch snakes very often, I don't know. But basically, this is the business end of the antibody. That's the antigen binding part. So that's like the fangs of the snake. You don't grab a hold of it by the fang if you want to make it not able to work anymore. You grab it by the back, okay? And now that fragment of antigen binding is not going to, neutralize or agglutinate or whatever, act on that those outer antigens of that pathogen. Okay, so again, kind of a neutralizing of antibody function. Lots of different exoenzymes. Coagulase, there's one that should look familiar if you're in lab. This clots blood. Okay, so if you're testing for this, you inoculate some rabbit plasma, a nice heavy inoculation, incubate it for a little bit, and look to see if you get a big clump or a big clot in that rabbit plasma. I don't know if it doesn't have to be rabbit plasma, some kind of blood plasma. It's probably cheapest for us to, harvest that from rabbits. That's why we use that. Okay, but that coagulase exoenzyme, by clotting the blood, that helps the Staph aureus establish itself in the host. Okay, it's able to kind of, we talked about this before, but it's able to kind of wall off the site of infection so that our innate immune cells, like our neutrophils and our macrophages, can't get to it. So it has a chance to reproduce and grow in number. And then when the time is right, it'll produce some kind of kinase, in this case, staphylococcus, in order to dissolve the clot and probably further invade into host tissue. Hyaluronidase, that's another one that we talked about before. That's going to break down the matrix between cells, say between host cells, kind of the glue that holds cells together. So another invasion enzyme. And lipase, of course, that's another one we tested for in lab, hydrolyzes those bonds in lipids. And we have some kind of oiliness on our skin, right? So some strains that can digest those oils in our skin are going to have a better chance of causing some skin infections. Beta-lactamase, we're hitting back on stuff again that we did a while ago. Remember, this is an enzyme that certain strains have that enable the organisms to be resistant to certain antibiotics, beta-lactam antibiotics. Okay, so it alters that beta-lactam ring, again, of some antibiotics. So there are others. These are the ones that kind of we talked about before, and I wanted to hit on again. Some exotoxins. There are exotoxins called, there's no endotoxin. Remember, this is a gram-positive organism, so no endotoxin. But some exotoxins like hemolysins are technically exotoxins. And we mostly will talk more about hemolysins to do with streptococcus organisms, but actually Staph aureus is beta hemolytic as well. Okay, but in general, hemolysins will lyse red blood cells. Okay, so this actually describes a certain kind of hemolysis, beta hemolysis, total red blood cell clearing. Now, you would think that, with a Staph aureus infection, that would cause a lot of damage to our bodies, but we think this effect is kind of minuscule in an actual infection, that it shows up a lot more in the lab. So it shows up much more in vitro, in a petri dish than it does in vivo. Some strains make enterotoxin, right? Not endotoxin, enterotoxin. Remember that prefix entero means intestinal. Okay, so these are toxins that induce nausea and diarrhea. So or Staph aureus is a common foodborne pathogen. It's actually heat stable. So why is that important? If the food gets contaminated and then it's refrigerated and reheated, you would think that reheating it might degrade the exotoxin, but it doesn't. Okay, so it can keep on causing problems. Exfoliative toxin, that makes our skin cells separate, pull apart. We'll see an example of an infection where that toxin is present. And last one, toxic shock syndrome toxin. We often abbreviate that TSST. That's a super antigen that causes this toxic shock syndrome. So we'll talk more about that. Remember, super antigens cause massive T cell activation. And along with that goes too much cytokine production, too much inflammation, or overwhelming to the host anyway. All right, so let's look at some common Staph aureus infections. They can be pretty innocuous all the way to life-threatening. Impetigo is a common skin infection. Little kids get it. They pass it around to each other really easily. It's just these kind of pus-filled sores that show up usually on the face, because little kids especially wipe their face a lot. And again, it's not really a problem. It doesn't really go into deep tissue, but it just, these little scabs that just kind of don't go away. And eventually they'll scar the skin, because it takes the body a long time to fight off that infection. So usually you want to treat that with antibiotics just so it doesn't scar, and so you don't pass it on to other people. Folliculitis is another fairly common infection. It's an infection of a hair follicle. So again, that lipase, that exoenzyme that's produced, helps the bacteria kind of establish itself there a little bit. Usually gets kind of a little pussy pimple kind of. More common on areas of our skin that have been irritated by shaving or just by wearing tight clothes. Okay, so usually, this heals up after a few days. It's usually not too big of a deal. Again, kind of pus-filled pustules, but occasionally that folliculitis will get a little bit worse. It will get a little bit bigger, a little angrier looking, and then we would call it a furuncle. Again, usually these will heal up on their own, but they have a little bit more, possibility of penetrating into deeper tissue. If the patient has a fever, definitely want to get that treated with some antibiotics. And when multiple furuncles kind of coalesce together, we call them carbuncles. Okay, and then these usually need to be lanced or cut open and the pus drained out. Patient needs to go on antibiotics. Again, potential for some deeper tissues to be involved here. The back of the neck seems to be a common place to get these. I don't know if that's a place we don't wash very well, but good hygiene is always gonna be a plus. Another one that often, here's some other pictures from OpenStax. Like, you search this stuff and you get some really nasty looking pictures, obviously. Another strain of Staph aureus that has those beta-lactamase enzymes is known as MRSA. All right, we've talked about this one, methicillin-resistant Staph aureus. Not only resistant to methicillin, but lots of the beta-lactam antibiotics. Sometimes we'll get a sore on our skin and we don't know where it came from. And you might say, oh, it was just a spider bite. Well, at least in Michigan around here, spider bites are actually really rare. If you have something that's caused by Staph aureus or MRSA, it's usually going to be pretty pussy. So that would be present. And obviously, you get this redness. Okay, there's some inflammation going on there, and you want to, people tend to kind of poo-poo skin infections, but anything that's, after a few days not starting to heal up, you probably want to have it looked at. Again, especially if the fever is present, the redness, the pussiness. But MRSA most often presents as skin infections. That's when we consider it community acquired, from a locker room or something like that. It can be hospital acquired as well. That's more often maybe in deeper tissues. Again, somebody has like a knee replacement or a hip replacement, and that organism, kind of forms a biofilm on that implant. That's much more serious as a result of some kind of surgery. The good news is, as of 2020, there was only about 3,000 cases of MRSA in the US. So the incidence of this, for reasons we don't understand, seems to be decreasing a little bit. So I guess that's the good news. It's just harder to treat. It's not a particularly aggressive infection, MRSA. It's just, harder to find the right antibiotic that's going to treat it. And then there's the potential for Staph aureus infections to be systemic, meaning they're infecting not just kind of one spot of the body, but lots of tissues, maybe several different organs, maybe the whole body. Usually people that are otherwise healthy are not going to get a systemic Staph aureus infections. It's maybe if somebody has some other chronic disease or is immunocompromised in some way. But there's the potential for Staph aureus to infect the bones, and then we call osteomyelitis. So I did a very bad job of citing this picture when I first posted it, but this picture here is of a young Ethiopian girl. You can see her femur bone there is infected, and it's not the right shape. She wouldn't be able to walk on that. It'd be associated with really high fevers. So people, when they're treated for osteomyelitis, have to have IV antibiotics, long hospital stays, that sort of thing. Adults more often will get this infection in their vertebrae just due to specifics of blood flow. And I don't actually know what this other bone down there is, but again, not common unless you're otherwise not healthy, or if you've had maybe some trauma, some accident or something. Pneumonia, Staph aureus causes a particularly severe type of pneumonia, pretty high fatality rate. Endocarditis, that's infection of the heart valves. Not common, but pretty serious when that happens. Again, meningitis, not common, very serious when the outer coating of the brain gets infected. And bacteremia, that's pretty much the same thing as sepsis. That's when it's in the bloodstream, and it can, again, go to anywhere in the body. Okay, so those are not common, but potential infections. Staph aureus infections that are particularly caused by a toxin, the scalded skin syndrome. Doesn't that look nasty? That's strains that have this exfoliative toxin. So basically it causes the skin to slough off. And of course that opens the patient up to lots of secondary infections because their kind of first line of defense is not there anymore, almost like a burn victim. This can be pretty serious in adults because for some reason adults have a harder time ridding that toxin from their kidneys. Kids seem to recover a little bit more quickly. Food poisoning, we talked about that. Strains that will carry with them an enterotoxin. This is a pretty not super serious food poisoning, lasts about 24 hours. Most times when we eat some contaminated food, it's because the food has been contaminated by some agricultural runoff, some livestock, but Staph aureus food poisoning, it's somebody that had a sore on their hands that was fixing the food, and it's from human contamination. So Lastly, toxic shock syndrome, potentially deadly infection again, that toxin that's a super antigen just causes widespread, overwhelming inflammation, so much that the blood vessels get so leaky that patients can go into shock. This actually hit its peak in 1980 when a super absorbent brand of tampons came on the market that were basically like diapers. That's how absorbent they were, and women could keep them in for hours and hours. But the problem is that that provides an ideal breeding ground for Staph aureus, a nice warm pH, great, perfect pH environment. And since those have been pulled from the market, incidence has gone way down. Tampons are generally considered safe to use, but read the directions in the box. Don't leave them in for more than 5 hours, so don't leave them in all night. But this infection can also infect men, usually as a result of some kind of surgery or something. High temperatures, rash, confusion, particularly nasty. Okay. We'll finish on Monday with Streptococcus. Have a good weekend. Okay.